All right, everyone. So, welcome to another episode of Innovators of Health. Today, here we are with the one and only Dr. Chui. Dr. Chui has so many accolades, and he's such a superstar in the field of dentistry. And I can't wait for you guys to hear about what he has to say. Here with my co-host, Dr. Rahul Desai, and we're gonna jump right into it. So, Dr. Chui, thank you so much for being here with us today.
It's my pleasure.
Let's let's just jump into a little bit of your origin story because I want to hear about how you got into the field of dentistry, specifically a specialist in TMD. So, um, why don't you tell me what was your aspirations, inspiration, and how you chose this as your
Well,
field?
as growing up, I always wanted to be a doctor, a physician, and all the way around high school and middle school, I always wanted to be a doctor. I think I kind of changed my perception of healthcare ever since the first semester in Berkeley that I went to college with, and then I just realized that I do. Um, like the healthcare way that I can treat patients. I'm a social person. I love seeing people. I love working with people, and I like the science. I like the art. I like the uh, uh, Texas mind that I would enjoy treating patients with the social side of myself. And the more I talk to more people, the more I realize that I also like the business side of the healthcare. So I just didn't get, oh, maybe someone told me maybe you can look into dentistry. So since first semester in Berkeley, I just realized, oh, that might be something I like. Once I decided, and that's all I want to go, and that's what I want to do, and I just this is the path that goes to. I wanted to go to dental school, and I, just went to dental school, and um, next step would be UCSF, and then one continue from Berkeley to UCSF, and then graduate from dental school, and my dental career just started to take off. And in the beginning, I did every single aspect. I treat every single patient with many different area in dentistry. Pretty much everything I seen, every learn in dentistry, I touch it all. I learned how to treat patients with orthodontic treatment, learning the lateral shaft, wires and brackets, and bending the wires, and from go through a lot of continuing education, training patient root canals, bone graft, extractions, implants, anything's there that 3D CAD CAM, everything that I learn along the way, I just love it. And everything I see, I just want to do more and more and more. And all the way until I start to get to learning patient screening kids and adults with functional appliances and realize that, hey, this is actually really, really important to look at everything in a big picture. We no longer just look at a single tooth. We're now looking at a couple of teeth and to treat patients feel better with the cavities or with infection of the tooth and put a crown to protect the teeth. I start looking at everything in a big picture and how can we allow the patient to feel better just by allowing the patient have a better jaw relationship from the top, just looking at everything from how you allow the jaw in a better position, how you allow the muscles to relax, how do you allow the patient to sleep better, how you allow the patient to feel good to balance what we call the autonomic nervous system to activate the parasympathetic nervous system and also to balance the way that you do not activate the sympathetic nervous system to create fight or flight responses. And all these started when I started looking at occlusion. Coming from a nerve, it's called trigeminal nerve. I don't know if I can go into so much detail in the scientific name in terms of that, but what we really know is the nerve that controls the jaw and the teeth is so powerful and so sensitive that just a tiny little toothache can cause and wake you up all night. You cannot go to sleep. So why can we really calm everything down? So brain will have this neuromuscular feedback, and whatever you feels good. The output with the muscle will feel good, and that in return, if something at the same time, if something's not comfortable, your muscle's not going to be comfortable and come back and give you some discomfort and pain, causes inflammation, chronic pain, and how you avoid
Uh-huh.
some discomfort and it causes compensation of the posture and from coming from the beginning of your joint, which is the beginning of your spine. We're looking from head
Mm-hmm.
to toe. And the
Yeah.
jaw is completely a little bit torque and joint way. your jaw, your body's going to try to compensate and it's going to go back to your neck and back and shoulder, everything else going to be connected together. So now to establish the really good jaw relationship, and that's how we know that the patient going to feel a lot better. So ever since I discovered this, my heart is all into it because I know there's a lot of time we're looking at this physiological or muscular aspect of dentistry that can we can really treat a lot of patients with a lot of other really serious medical condition, and patients feel a lot better.
That's super
That's great.
interesting.
Let's
Jay, I,
go ahead, Raul.
I just wanted to ask because I hadn't ever heard of that concept before. I was just wondering if you could talk a little bit more about that as a spine specialist. You are the first person that I've ever heard
Hmm.
say that the spine starts with the temporomandibular joint. And I'm
Yes.
just thinking to myself, like, what's the most cranial or cephalad joint? I guess it is the TMJ.
Yes.
But I've never heard that. Can you just maybe talk about that concept a little bit because it's foreign to me, but it's really interesting.
Yeah, the cranial facial jaw relationship is very, very important. And everything that we're looking at this area is innervated by the most sensitive nerve, cranial nerve in the brain, trigeminal nerve. Trigeminal nerve has the biggest cranial nerve or sensory nuclei coming from the brainstem all the way to the cervical area, which is in the spine, the spinal tract of the cranium. So it's a really, really long sensory nuclei that constantly is to absorb sensory input to your brain and send a signal to the brain and digest information, go through the motor neuron, coming back for the neuromuscular feedback. So this is all these are controlled by something that or initiated by a lot of things that we deal with like on a daily basis. Well, around all these area, what is the biggest impact around the jaw relationship? Usually coming from the teeth. Teeth can produce thousands of pounds. You swallow thousands of times. Every time you swallow, you create a lot of pressure against the skull and the brain, and affect going back to the musculature area, which is coming from the upper cervical area. Upper cervical area is actually very important to control many different things. If you're looking at this area, looking at the area where all the remaining cranial nerves coming from the rest of the body, coming back out and going through the brain, they always go through this cervical area. And it's one of the main nerves that's connected to this area's biggest. Bigger nerves is carrying the parasympathetic nervous system from the rest of the body. How you can do better, how you can digest better, how you can control heart rate, how you can control the mood, how you can control more hormones. Everything depends on how comfortable you feel. When the jaw relationship is not good, it's going to talk the muscles of the jaw differently. And all the jaw muscles also connecting to the cervical area. And that's why some people, they have pain on the jaw. Your brain's going to tell you, hey, I need to stay away from the pain. I'm moving your head forward. Ah, that hurts you. For your posture. If you cannot breathe your nose, a lot of times it causes mouth breathing and jaw relationship to open up the mouth. And also the brain tells you, hey, I need to open up my airway more. Hey, how can I open better? For posture. So we compress a lot of nerve around the cervical area, including the cervical plexus and brachial plexus, all the way from the traps, the tennis elbow, carpal tunnel, and all of these areas connecting to the shoulder blade, connecting to the upper cervical area. That all these muscles can also connect into the cervical area originally and a lot of impact coming from your jaw. The
Hmm.
teeth can have a lot of impact on all these muscles that control a lot of issues that also connect to the rest of the body. However, one thing we realize is you cannot pinpoint what causes what, like which tooth connect to which position. However, a lot of symptoms on the rest of the body will feel a lot better, especially due to the musculature issues, compensation issues, and postural issues, can get corrected coming from the beginning of your spine when the jaw is in the right place and the occlusion in the right place when all the muscles are a lot more comfortable. A lot of times we can feel that when patients have headaches and migraines, the temporal area, when the jaw's retreated to the back, and you're going to fire up the temporalis a lot more when you grind your teeth. Everybody can do that when you grind your teeth and move the jaw forward, and the muscle feels a lot better, and the muscle's not as tight. So all these muscles connecting from the jaw and the head in that area can also translate to the cervical area. And it's just one joint connecting to the rest, and everything lined up together, one muscle connecting out, all beginning from the most powerful part of the body that contract the muscle, which is your jaw. So
So when
think,
you
Mhm.
when you speak of occlusion, what you're talking about is how that the temporomandibular joint, that jaw joint, how
Yes.
it's how it's opening and closing.
Yes, and also how you touch occlusion. So we're talking about two different parts here. A lot of time we're looking at the dental problems, right? That's how we align the teeth together, make it really nice. In this line, iron teeth. But that's also a skeletal problem, which is a jaw relationship connecting to the upper maxilla. So the jaw, if you have a torque on the maxilla, every time you bite down, the jaw's going to torque differently. But if sometimes the jaw is torqued a little bit like this, we might be aligning the teeth with Invisalign with a quicker jaw to start with. The jaw's going to be quicker like this. All this muscle is going to torque differently. But when you're young, a lot of muscles still going to be pretty comfortable. You don't feel a lot of torque in the muscle. But as you age more and more, with all these symptoms starting getting more and more, nasal issues, allergies, and also stress, you grind your teeth more, the jaw retreated more and more, forehead posture is getting more and more, then all these symptoms causing a lot of chronic pain slowly get worse and worse over time. But one thing we know is we can align the jaw relationship better, a lot of muscles a lot more aligned, the spine lined up a lot better, circulation is better, communication between central nervous system to the rest of the body is better, hormonal balance is a lot better. How your bodies control the rest of the body, how the nerves from the rest of the body come back to communicate with the central nervous system gets much, much better. Everything is just a lot more aligned. All these just coming back to the neuromuscular balancing. The brain's going to feel good, and the switch will come back and balance everything back. And that's how you feel better. You relax a lot more. You don't grind your teeth as much because when you're under stress, you're going to grind your teeth a lot more and cause a lot more problem. When you're a lot more relaxed, you don't grind your teeth. The jaw's a lot more relaxed. Everything lined up a lot together. I love that. So that's how patient feels much, much better. Around the jaw joint, there's a lot of nervous system and system is actually very, very complex. When you look at a trigeminal nerve controlling the muscles, most of the time you're only thinking about the muscle mastications, temporalis, masseters, narrow territory, medial territory, but it also controls 4 other different muscles around the tongue, middle higher, the antidigastric. This control the tongue, whether you want to breathe through your mouth or not, and how you can control all these muscles to relax the muscles around the neck too. But there's 2 other muscles really, really important that coming from the back of the trigeminal nerve. One will control the muscles that pull in the eardrums called tensor tympani. One muscle is called connecting to the eustachian tube opening is called tensor dili palatini. Imagine these muscles tight, those muscles also tight. That's why patient will potentially have tinnitus or ringing in the ears. I feel like the ear is plugged. And all these are ENT issues. A lot of times ENT, they do a CT scan, MRI, patient keeps hearing sounds. What's going on in here? They do this hearing test, everything's clear. Sometimes, occasionally, they might refer patients to psychiatrists because, oh, this is something that maybe you have some issues with mental or some issues that's not comfortable, or maybe all these symptoms that you experience always mimic depressions. Well, depressions is a big thing, can affect the body a lot because you can affect a lot from central to physically to chronic. This is very, very important to clear. However, a lot of times in psychiatry's point of view, depressions, one of the key treatments that we use a lot for very effectively for a lot of patients who have depression is putting a lot of medication like antidepressants. However, many antidepressants come with one side effect, sleep blinding. So increased
Mm.
sleep blinding, not just something cause more symptoms. But what is really causing the problem? Is patient really having depression or patient having chronic pain that may make depressions? So we have to unpeel all these things to find out, can we let patients feel better, align the jaw with a lot of jaw pain, neck pain, headache, migraines, raining ears, to slowly get rid of that, the patient feels better, and the patient may have better symptoms, or patient truly have depression or not. Then we'll figure out whether you're going to give patient the medication. So all these are extremely powerful. I would look back from it, but ultimately really look at one thing that only dentists will see: the occlusion, the jaw, and the teeth. But that's why I really, really like this aspect that we potentially have the tools to treat a lot of medical conditions that only dental treatments can help with the medical disease or illnesses.
Dr. Chu,
When
you
you're
mentioned multiple things such as depression. You mentioned um, migraine. You mentioned some other issues, but what I'm thinking is, there's everyday people that have health issues that may not be aware at all that this is the core and this is the root cause of their symptoms, and they tend to start going other places looking for answers, yet they didn't it's not obvious that they should start with someone like yourself. Can you talk a little bit about that and talk about some other symptoms that are pretty common that people may not know about, that if they're feeling that and listening to this podcast, that they can say, wow, you know what, I may be missing a complete, you know um, the solution
Hmm.
to it.
Well, it's really simple. Anybody can Google TMJ issue,
Yeah.
TMJ posture, or TMJ skeletal structure. You can see how the jaw connect to the rest of the body. Some people will have neck and shoulder pain. Some people will have tingling sensation in arms and fingers, antennas, elbows, or even carpal tunnel. I'm not saying this is because of the jaw joint, but a lot of times it could be because of the cervical area coming from the brachial plexus that can be controlled by the jaw joint. Or truly tennis elbow, or truly carpal tunnel is it really, really what the case. Some people will have the shoulder blade hurts, or back and lower back hurts. And all these are coming from how you posture yourself. It could be truly coming from the TMJ, or it could be truly, maybe possibly coming from the ascending issues from the rest of the body going up. Patient might have scoliosis growing up and a
Mm.
compensated jaw joint. So where is the primary and where's the secondary that we have to test the patient and find out? The key is we have to get a correct diagnosis instead of just jump into surgery or jump into medications. So
Mm.
to help the patient with, and I think the key is what is the best treatment for the patient, what is the most conservative approach for the patient, and what is the easiest way to make the patient feel better to slowly filter out different parts of the root cause and say, hey, yes, we do need surgery, or no, we don't need surgery. So other symptoms like ringing ears, or headaches, some migraines, or chronic pain, sleep issues, sleep apnea. And a lot of times these can really, really come from one really, really important area, which is the jaw joint. We're looking at the airway. Where's the easiest collapse area, which is around the area behind the jaw and here behind the tongue. But really think about it, when you draw a cross section on the occlusion, going back all the way to airway, that's usually the airways that got obstruction. It tells you a lot about correlation between your teeth, the occlusion, the muscles, the jaw, and everything connected. Sometimes I joke around with my colleagues and the ENT specialists. Say ENT actually is not just ears, nose, and throat. You actually might want to look at ear, nose, and teeth, because ear, nose,
Mhm.
and throat, everything between are your teeth, your muscles, your airway, your tongue, and cervical area, everything combined together. However, what is the biggest impact? Your teeth that produce thousands of
Yeah.
pounds of everything else. But you cannot omit that when looking at ENT, because when everything's it's just the same thing. When you use the tongue to touch the palate, that's the roof of the mouth. Roof of the mouth is the base of your nose or your sinus. It's the same thing. Why are we not looking at that? But why should we look at it as something that potentially can affect all that? So we have to make sure we look at the whole picture and see what is this going on in here. Why is the patient having the earache? Why is the patient having issues?
Mhm.
Or cannot breathe their nose and now everything changes and patient grinding teeth more and cause a lot
Mm.
more other problems that can cause by initiate by the allergies, stress,
Yeah.
pounding, and then now hurts on the back and lower back and all the way down the back. So find out the origin of the issues here. But a lot of times it's really, really interesting. We're looking at, should we go back to the origin of a lot of issues that it is in the healthcare, the medicine now, we're looking at systemic issue from stemming from inflammation of the body, right? Allergies. How can we get rid of the symptoms? How can we get rid of this chronic pain? Decrease stress, decrease cortisol, produce affection, decrease inflammation. The body can heal a lot better, a lot easier. I think this is much better than just jumping into a more aggressive treatment right in the beginning.
How do you,
Rahul, what
as
are
a
your thoughts?
physician, yeah, I was just wondering about, I've been treating pain for almost 2 decades, and it's just not something, unless somebody says this hurts, I'm not assessing their TMJ, their bite. We're seeing chronic inflammation, treated tens of thousands of patients
Mm-hmm.
for cervical spine. And I've treated a few TMJ patients with cell therapies, PRP, and other things just because they said, okay, you're doing this. This hurts as well.
Mm-hmm.
Can you treat it? And then, we're going to talk a little bit about PRF, and it worked amazingly well for arthritis there. But
Mm-hmm.
never did I have an assessment of like what you're talking about.
Mm-hmm.
And I've been missing the boat. How do medical providers, how does the medical community
Mm-hmm.
assess this, and how do we not miss it? Because I get my teeth cleaned. I mean, knock on wood, I've never had cavities. I guess strong teeth, but I have I go to the dentist. I've had my teeth cleaned, but I've never had that even talked to me about. So if patients aren't blessed or lucky enough to come see you, for whatever reason that they get to see you, are they going to get these types of assessments elsewhere, or how do physicians that are listening to this podcast or patients, how do you kind of advocate for like getting this proper assessment? Are there docs out there that you learn this from, or that you're training, and are there communities that we should be
Mm-hmm.
introduced to? Like, how do we even know about this?
Yeah, so I mean, it really comes down to a lot of educations. Looking now, I'm the clinical director at the VA Medical Center in the Dental Sleep Medicine and TMJ Clinic. At the VA, everybody on the same platform. So it involves a lot of academics. I teach both medical schools and dental school. The fellows and residents who come around with me and they see the whole picture. And why is patient having sleep apnea? We have a lot of chronic pain with the headaches and migraine and grinding their teeth and back and lower back pain. We have to assess the situation. There's something that you can do and test the patient with certain nerve test to see if someone have pain with arm and fingers and the strength of the ulnar nerve, and how can you increase the strength by changing the bite position instantly. You can feel the patient feel a lot better. The pain goes away, or rotation is a lot better. The patient can keep the core better by biting the jaw in different position. That tells me something that potentially is coming from the jaw or the origin of the problem that can help. Maybe not the origin, maybe you can also help the patient feel better. And how can patient align the body better by biting something down in so that you can align the body better with the muscles. It's not torquing in different position. All these can be tested, and I think it's just require a lot of education in a way because we never learn in dental school. We never learn in medical school, and someone just have to be humble enough to learn it from chiropractors or physical therapists or a DO or neurologist and doing all these things, combine them all together and keep learning from different people and put them all together. Just stumble that we are lucky enough as a dentist that dealing with the area is just so powerful that realize, hey, this can help many different areas if the jaw is in the right position, as long as you get the diagnosis right. When someone suspects there's other symptoms coming in here, you have no success. Or someone constantly having repeated surgery for a carpal tunnel surgery. This is very common. You have to do it again and again. But where is it coming from? Could it be coming from here? Oh, if this coming from here, potentially this coming from the jaw joint, patient usually will grind their teeth a lot. So we can refer them to a TMJ specialist. And there's some of, and it's not that a whole lot of people that out there just like, oh, a lot of orthodontists, but there are certainly some TMJ specialists everywhere in the country. However, the key is to find out the situation to refer. Because right now there's no even such a thing to refer a patient for TMJ because it's really rare. And if physicians will say, hey, let's refer you to TMJ specialist. What are we looking at? How we would find out? And there's certain symptoms that we could not resolve. Maybe have the patient to try to see just do the treatment on TMJ because all the TMJ treatments that we try to work on the patient usually are very conservative. It's non-invasive, it's very conservative, and usually it doesn't involve with any scalpels or medications.
Now that's what's fascinating. Is there a go, we're talking about the occlusion. When they come see you, are there certain devices or tests that you can do to, I mean, that sounds like just biting in different jaw positions might give you some insights. Uh, what's kind of your go-to workup if somebody comes in and you suspect
Mhm.
uh, an issue? Is there a diagnostic workup, or what's your path to get them better?
So we always come, the patient come in the office, we always involve with something called CBCT scan. You have to look at the joint. You have the 3D image of the jaw to look at the airway, look at the spine, look at the arch, look at the skeletal, look at the symmetry of the face and the skull. When the jaw, when the skull is not symmetrical, somewhere is gonna give starting with the teeth and the jaw. It has to be. Um, Look at the spine, how is it lined up better, or look at the airway, you can see where the patient's struggling for oxygen or not. And that's really, really important to get to take a look at that. And also really, really always we have to look at the medical history, medication the patient's taking, any symptoms, and the history of the pain. Patient might have a car accident, right? Patient might have issues with injuries, falling down, hit the front teeth, patient might also hit the chin that we can never think of. That, oh yeah, I remember after the fall, my bite changed. Upper teeth will not change the bite. It happens all the time. So since I remember I could not chew as well, it has to be coming from the jaw. It has to be coming from the condyle. It has to be coming from the trigeminal nerve. So all these you have to really go back and kind of do an investigation of what patient has been through. It has to be really, really thorough. What medication are patients taking? Are they taking antidepressants? Are they taking any medication potentially can increase teeth grinding? Are they taking any medication can affect get the mouth drier? And the patient I cannot breathe well, or any things that can affect that, and history of ENT treatments and any orthodontic treatments. For example, some patients will have bicuspid extractions done when they're younger with the braces and involved with headgear or pulling the jaw back in position that potentially can affect the jaw joint and compress the joint more. And now the patients might potentially even have a retainer, which is fixed, a wire for years. And all these can cause the jaw lock in position that cannot get relief because of the teeth bring the jaw into position again, again, and again. Now, for example, go and swallow. You swallow, the teeth touch. It has to go back to that position. If the jaw's not in position right, every time you swallow, you're going to have some chronic pain touching the nerve somehow. You swallow thousands of pounds. It's going to affect you one side more than the other side. Or somewhere along the way that we have to find out the position of that. So the history of dental history is also really important. And someone, do they have a lot of major dental work done? Or they have full dentures done or something like that, then the bite can be more collapsed or more too open. All these can affect all that too. So then we do an assessment of the symptoms. The patient, does you have jaw pain, headaches, migraine, neck pain, shoulder pain, um, and the patient have any surgery done on the knee and hip, because that can affect the posture. That can come back and affect that too. And all of these, you have to find out everything along the patient. When they did the surgery, do they feel better or did they feel worse? If they feel better, it's slowly coming back because of what? And I have more symptoms somewhere else. And someone doing chiropractic treatment, because you start aligning the spine better, you will affect the jaw joint, going back on the top. And now, oh, now it's getting more headaches. When I align the body better, because you try to align back, but the jaw is not in the right place, you climb more. Or versus you correct the jaw and the spine now is a lot better, then you can line up much better, but they still have some pain there because you're not lining up the spine differently. So all these are combined together and just you have to do perform certain tests on the patients to see how much they get better and not better. Sometimes you can using some different bite types of patients to do different tests to see if they feel better or worse. So we have to find out where are all these pain coming from. Whether we can treat the patient as primary TMJ problems, we could primary is coming from the bottom of the spine, or it's coming from the hip and the knee. And that's why we have to refer patient to you, the spine specialist, or chiropractor, or physical therapist. Nobody can treat patients just by yourself.
Yep.
You have a team. You have to have orthopedic surgeon. You have to have a chiropractor, physical therapist, myofunctional therapist. You have to have ENT in place. You have to have orthodontist. You have to have airway specialists and even acupuncturists. Everybody has to work in the same goal, but everybody just need to communicate with one another, and they can accomplish the goal of treating something called comprehensive treatment for the patient. Because it's not just jaw; it could be your nose, it could be your spine, it could be your hip, and all these will cause stress. Then comes back to it, you grind and clench your teeth. So once you feel a lot better, patient will grind their teeth a lot less inflammation, and a lot less chronic pain, and you will sleep a lot better, with a lot less compromise of the airway because the muscle is not as tight.
And then if for your sphere of influence, when you're doing the treatment, you're using, so, they get this workup. There's obviously something wrong with the TMJ or arthritis or dysfunction, asymmetries. Then you're using like a bite device or an oral device. And then I know you're using lasers, photobiomodulation, and some other things like PRF. We came together with kind of that regenerative medicine, a PBM world.
Mm-hmm.
Can you talk a little bit about that? Like how
Sure.
when you start implementing those tools?
Yeah. One thing we know for sure, teeth usually cause a lot of problems with the TMJ issues, right? When you swallow, teeth will compress the joints. Sometimes it causes pain. So if that's the case, you don't want the teeth to touch to the position that you're touching right now. Then you find out the place where are your jaw supposed to be at. This is the key, the bite, where the jaw is supposed to be when everything feels good, when everything aligns together, when the jaw is not compressed, when the nerve is not irritated, when the autonomic nervous system uh, uh, more balanced. That has to be from the patient. I cannot find the jaw relationship for the patients. When patient's comfortable, everything else will be comfortable. So um, there's a lot of different school of thoughts in treatment occlusion, but my personal belief is you have to make sure you start from the patient. When patients think they're comfortable, they are comfortable. So you want the patients to feel better. So sometimes we use tensing unit to target the three different cranial nerves, the trigeminal nerve, the facial nerve, and also the accessory nerve with the head and neck positions. All the muscles have to relax, and jaw's gonna go to the position a lot easier, a lot more comfortable, a lot more aligned. The jaw can drop like this position, or goes downward and forward, or go to the position where the jaw will feel really good that the teeth are no longer touching. And we capture that bite and fabricate what we call ventricular, uh, 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 physiological or neuromuscular balance orthotic. That would not be exactly the same height coming from the jaw from the patient. And along the way, things going to feel a lot better. And once you put it on there, a lot of muscles going to feel a lot better. Immediately, the headaches and migraines feels a lot better. The jaw relations feels better. The neck and shoulders feel better. And when that started to happen, something else going to go down more and more to relax more and more, including the cervical area, the posture, and slowly go down more and more. It goes back and forth, and align the spine better according to the jaw relationship to start. And along the way, we talk about the photo modulation, which is really, really critical in treatment for reducing inflammation at a much faster speed and a much more comfortable treatment for a patient that should be through more effective and more efficient way. Um, Photomodulation is great because before we use a lot of needles and injection and things like that, but light, including laser, or red light therapy that we use on the patients, we know basically, I don't want to bore everybody too much with the science, but you just want to hit the light onto the cellular level to hit one cell. Inside the cell, we have mitochondria. Mitochondria will be responsible for healing and feeling better, reducing inflammation, all that. But if we can activate mitochondria to work harder and faster to produce more ATP for you to feel better, everything's going to feel a lot faster. And red light is a really, really good way to hit on the surface of the body that you can produce more stem cells to recruit different cells to grow different things. Or you can help the patient reduce inflammation a lot better. And it's not just for the jaw, it's for everything in the body, including how we sleep, how we move, and the digestion and everything else is going to come along at the same time. And patient comes back in 53 weeks, certain areas still hurting you, then now we can use a laser, which is a lot more direct and focused on those muscles. When those muscles relax, the jaw's going to relax more, and that's why the occlusion, the bite, the change differently with the product. That's why we adjust the occlusion to make sure everything's balanced, and let the spine continuously and slowly be aligned and relax more and more, really coming from the patient, where they get better and better and better. We go back and forth, and let the patient get better. You just need to adjust that fabric with the inflammation removal and also with with the light therapy to work on it. And slowly you can get a majority of the symptoms starting from the jaw. Pretty sure the patient will feel better. Pretty sure a lot of chronic things will get better. Pretty sure the patient will sleep better because the pain's gone. One thing you're not sure 100% is how about the soft tissues that protect the joint, the conda working against the skull, the disc, the fluid. I cannot put it back here if the jaw is not in a good condition. If someone is crunching the jaw so hard, the disc between the bone may get pressed down, may get perforated. We
Uh-huh.
have a tool in medicine, it's regenerative medicine, that is extremely powerful. Used now is the second generation. The first generation is PRP, plasma rich plasma rich fibrin. That a platelet rich fibrin is what we realize in your blood, the different components, the red blood cells, the white blood cells, and one really important component is the platelet. Platelets with the plasma, we can actually extract that part of the blood out because of the density of the component. We can centrifuge it with different protocol. We can crop this out and make it really, really concentrated because platelets is responsible for healing and growth. For example, you cut your skin, it stops bleeding. Blood
Uh-huh.
will trap the platelet and clot the platelet in place, and platelet will start releasing different growth factors to recruit different cells to grow different things back, to heal. For example, you need to grow blood vessels, angiogenesis, right? Connecting tissues, epidermis to grow the skin back. Maybe you get a scar or anything like that. But this has to be done by platelet. But it has to, by for the process that you want something to grow back. But can we grow something back to protect the joint as a cushion? In general, when you have a space there with orthotic, it's really, really difficult for it to grow on its own. Now, we use your body, the best part of the blood that's responsible for this healing, and crop it back. Now, the spleen open up the bite, and you have a space here. This is way better than PRP with the hips and the knees because now you always have the space as long as you wear the orthotic. When you have orthotics wearing, you have the space there. Now you need to do platelet in there is saturate the whole capsule with this with platelet, decrease the pH and lubricate the whole area and saturate the disc and remaining tissues with both factors start growing to grow the tissue back. And now the bone and bone are not grinding as much anymore. You protect the bone. Also, sometimes the bone can grow back a little bit more too, and slowly let the body heal with regenerative medicine instead of surgery. Cutting the and put the metals or the plastic there. Along the way, the light therapy will help tremendously to make the healing process a lot faster, a lot easier.
Yeah,
Well,
one of the things that I was really interested in what you're doing in some of the uh, in some of the fields of medicine. I've noticed that it's a lot of talk of lasers versus the LED or the panel like photobiomodulation or red light therapy, and you're kind of a pioneer in many ways, but also you seem to have found a really nice way of combining them because I think it's all photobiomodulation, that's the term,
mm-hmm.
but you're using it both in the clinic and at home, kind of blending both both methods, both medicines really nicely. Can you speak to that?
Yeah, so patient every time they come to office, we use laser, definitely feel much better. We relax their muscles, get rid of the pain, get rid of inflammation. But we want it to be continuously. So laser is great because it really focuses on specific area and penetrate in depth and get rid of the symptoms and we can adjust the bite. However, we want it to be continuously when patient's not in the clinic or in the office. The red light therapy is actually great. The patient can use it on a daily basis continuously while the patient's not in the office. And that's how we can eliminate a lot of visits from the patients. They don't have to come back to our office and do laser every single day. But they can use red light therapy on their own term whenever they want, before they go to bed, after they wake up in the morning, in the middle of the day, when they're eating breakfast or eating dinner. Everybody can use the red light. Red light is the same light coming from the sun that we don't have it now when we're not walking outside as much as we used to be. We need this red light to activate the mitochondria for us to to heal and let the body function a lot better. But we just crop the best part of the light from the sun and just put it on inside indoor and let it run. It's really, really interesting. We know that one side of the spectrum, red light, is better for you. Blue light is damaging you. So you want to stay away from blue as much as possible, and red to be a lot more better for you to heal better. So if you have the patient continuously to have the red light therapy every single day until you see the patient back again for the laser and adjustment, the result definitely will be a lot better because patient continuously having this photomodulation and let the body heal continuously, reduce inflammation and pain, which is really, really great because patient will feel better and better more and more every day. The key is, can we expedite it faster, a lot easier, um, and for the patient to 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 let themselves to do it whenever they want. I have a red light here in my office that I always use it every day myself.
Oh,
I always
nice.
Oh,
my
nice.
lights are turn on
Yeah.
like
So
that.
what have you been feeling ever since you've been
Yeah,
using
I
it?
mean, you know, I mean, you sleep better, and you definitely feel everything's just different because oh yeah, that's great, but you can't really explain things like what really
Yeah.
happened. Just feel good. And some people will have chronic pain, chronic arthritis. I get one from my mom, from my sister. You guys know that I bought it from my family. Then they're using it too. And my mom had some kind of injury on her knees before, and now putting light on there. She said, "Oh yeah, it feels better if she put it on every single day. It really would help her to reduce the inflammation." But this is the key. Is I just like the concept because for my treatment, my philosophy, I don't really like medication. I don't like surgery unless you really have
Mhm.
to. And all these just fall into my treatment philosophy, and everything works out really, really well. The most aggressive treatment is drawing blood and put injection on jaw joint. That's the most aggressive I can get. But we know that it can significantly reduce a lot of aggressive surgery, especially the TMJ surgery. When you can grow things back, or you can
Mhm.
delay the surgery, even though you need surgery in the future, the surgery is not going to be as intense surgery as you need from the beginning. So if the patient feels better, the anatomy is not completely 100%. You don't need to build everything back with metal. The goal is to get rid of the symptoms, prevent from getting worse over time, and prevent a lot more aggressive treatment. The orthotic and PRF and the light therapy can achieve all that majority of the cases, and patient will feel
Yeah.
good. Do we really need to look at the surgery?
So you mentioned PRF, and I'm just curious with PRF, what you are finding with PRF treatments and in conjunction with red light therapy as being an adjunct to it. And Rahul, maybe
Mhm.
you can talk a little bit about it too, because there's some, what I understand, some preconditioning benefits to it as well. And Rahul, when shining on red light on, during the PRF treatments, maybe you can talk about that too.
Yeah, I mean, Dr. Chui, I mean, we talked about a couple of different things. The red light is going to, or photobiomodulation stimulates the cells, and so you can stimulate the cells in the body, right? You can shine it on the
Mhm.
jaw, the body, the abdomen. You can create that, but you can also, when you're making the medicine, this PRF or PRP or stem cells, when you have this medicine, if you irradiate or shine the light on the actual syringe or the test tube where the medicine is, it's going to do the same thing with those cells. It's going to turbocharge them. They're going to
Mhm.
work better. They're going to have more ATP, right? The mitochondria are going to be more effective. They're going to create the like healing genes better. Right? All of these like downstream factors that happen in the body, you get to, and the fancy term is called ex vivo, right? But it's outside of the body. But that's another way of leveraging like the device that Dr. Chui has that he just showed. It's so simple, like 60 to 90 seconds of irradiating that tissue. Irradiation sounds scary, but all it is putting the light on the tissue, just putting that, illuminating that medicine allows it to work even better in the body. So there's all this new science, and it's super fascinating, and it all comes down to regeneration, and that's where I'm going to plug one more plug for TMJ. I have been doing regenerative medicine as a radiologist for almost 20 years, and it's been unbelievable to see broken tissue heal, right? Because I was not a believer. I'm like, this is hocus pocus. You're taking somebody's blood and injecting it. Nobody taught this to me in medical school. This is all, it doesn't work. And then we treated somebody in that first case where it was broken, and then we scanned them 6 to 8 weeks later and it was healed. It was unbelievable. And that was tendons and ligaments. I joints like knee joints, hip joints, and things, you'll see improvement over time. But the improvement that I saw in TMJ, the cone beam CTs, I have never seen it in other areas. I mean, it looks like a new joint.
Mm-hmm.
And I think it's because of this. They're using the orthotics, and they're changing the bite. They're changing and you can talk more about it, but I'm flabbergasted. Like I did not imagine that can happen in like 12 weeks. This is
Mm-hmm.
not 2 years.
Mm-hmm.
This is a few weeks, and it looks like you just gave them a new joint.
But this is the science that we use it for years and years in dentistry. We use it for bone grafting implants. The PRP, we mix the platelet with the bone, putting the implants together, and it heals so much faster. So every patient we see the patients before we treat the patient, we have cone beam CT scan, and after we have the patient with cone beam CT scan. I've I've done many scans before PRF and done many scans after PRF. Every time you PRF together with the treatment, you always see the joint getting better. You always see new bone grow back, always. And in the case, do we really want to look into other aggressive treatment now? For me, that's going to be the primary treatment first, regardless now. And you use this a lot at the medical center. And now, for me, any patient that comes to me now, I don't even want to suggest surgery. I don't even suggest Botox anymore. There's no Botox. I don't do Botox. Very rarely, maybe just the beginning, the patient in a lot of pain. Hey, let's do Botox and make you feel much better. Mostly just one time. The most of the, I don't continuously give patient Botox. PRV Botox. The orthotic is Botox. Right? Everything aligned together. Patient feels better. Is Botox. You don't need to do it again unless it's for cosmetic reasons. But for functional, for pain, for wellness, no.
So cool. That's amazing. Well, thank you so much for your time today. We have more to talk about. I think we should do it on another episode. But one thing that maybe a preview, I would really like you to talk about performance on a future date. Jay, I don't know if we have time today, but we had a brief conversation offline about using this for not just getting rid of pain and dysfunction, but actually improving performance and optimization of health for athletes. And I know you work with Cal and super high level athletes in San Francisco area and the Bay Area, and people come from all over the world to see you. But I do think that just maybe teasing another episode with Dr. Chui is like performance enhancement of
Yeah.
getting that bite alignment and how it affects the entire body. So cool.
Yeah,
Yeah,
that's what
Dr.
we have
Chu,
a lot.
yeah, talk about it.
That could be a lot of implication for future in healing for patients, especially after strokes, the rehab, and how do you improve the physical therapy outcome by aligning your body better, how you can exert your muscles and recruit the muscles better again, coming from the alignment of the body. Pretty cool.
All right.
So, Dr. Chu, tell us a little bit. I mean, I was fascinated when you were telling us about your involvement with sports and everyone else that you're involved with. Let's talk about a little bit about that because I know that's a passion of
Well,
yours.
I mean, this is something that's it's just science, and when um, the body aligned together, you're gonna be able to maintain a core better. You're gonna be able to exert your muscles better. Like everything's
Uh-huh.
balanced, and you'll be able to chew food a lot stronger. You'll be able to lift weights a lot more. All coming again from the beginning of the spine. When this is balanced, everything else will be balanced a lot better. And when you have uh, 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 the jaw in a good place and the spine lines up a lot more, you can rotate a lot more. You can control your body better, and I can maintain your balance better. Everything else is going to be better. So imagine you can turn your neck even easier, right? How are you going to become a quarterback? You look at sideways, right? And or how can you stabilize yourself and feel a lot more comfortable holding the basketball and throw the ball? Or how can you use the playing golf and center yourself better? And how can you concentrate because you are controlling your grip and controlling your body a lot better, that you can swing and exert the force in the muscle with a lot more confidence. And all these are coming from the beginning of the jaw. And it's really, really important to make sure the patients are comfortable when everything is in the right place to start. I
Uh-huh.
always use the same analogy. If you want the car or train to drive in the right direction, the first the first joint, the first cable has to be in the right place to go straight, or else you're gonna go sideways.
Yeah. So how
And
does
so
this impact
it's using a
fighters?
bite guard.
Yeah, because you can align the jaw. So, for example, if the maxilla is torqued differently, I'm exaggerating, right? The jaw's going to torque different. Every time you bite down, it's going to be like this. So, no matter what happened there, you don't want to torque a jaw that control the neck and shoulders and cervical area, but you want to do this instead. So, whatever put between your teeth will have different thickness, 360 degrees. Like it's like an airplane, right? Upper, you don't want the upper maxilla to control the mandible. You want the upper, no matter what happens, you only want the jaw to be balanced. Where is the bite? This is not your bite. This is your bite. And then you have the mouthpiece there. So eventually, when everything line up together, so some other things can to fix it permanently. Either you use orthodontic treatment to put the teeth there and close the gap, or restoration to do some form of rehab to balance everything back. There's a lot of cosmetic outcome into it because we a lot of science coming to in place. We use golden ratio, golden proportion, how you calculate the numbers in this universe. When everything's in the right place, the proportion of the face and the jawline, position of the jaw front and back, and the teeth, everything will align back together. And that's how you improve and enhance the cosmetic outcome of the jaw and the smile. So you smile why everything's symmetrical. It's not just looking at teeth, the jaw, lips, jaw, everything is combined together. When everything's with the jaw come back to the right position, you smile, you'll be a lot more attractive because it's interesting that everything falls into golden proportion.
Dr. Chui, when these athletes are doing that, are they wearing that bite guard while that's when they're actually performing their sport?
Every
If they
Mhm.
correct that jaw alignment, they will perform better.
Yes, it was the same thing as treatments. Everything aligned together, all
Yeah,
the muscles. That's right.
that's interesting
Because I
because
see these wide
that's what I
receivers,
was
they
trying to
keep
ask you
the
about fighters. I'm actually curious about those like UFC fighters and boxers who are constantly getting punched in the face, and because all the other sports, yeah, you're using all the other parts of your body, but in those sports, people are attacking this area and you're constantly getting kicked or punched or something, right?
Mhm.
Right there. Have you treated anybody, any fighters, and is there a different, what have you seen there?
Yeah, there's you have to find that is part of it. However, you have to be very, very careful. Think about the teeth and putting down right now. You push the chin, you got accident or injury. It's going to go directly to the condyle and the fossa. When you look at the scan or look at the skull, look at any human skull, you can see the fossa. It's actually a really thin layer of bone. I mean, from the condyle, you have to be supported by the disc and cartilage. That's why you want to go with the PRF. But on the other side, which is your brain, cerebrospinal fluid, this bone is really, really thin. So when you are not wearing any belt or anything like this, when you hit the jaw really hard with injury, the teeth go back up really, really hard, and that's how you get concussion. So imagine you separate the teeth, you separate the joint. No matter how much you hit, you're not hitting the bone. You're not
Mm,
vibrating the brain. That's why it's so important to wear the mouthpiece to
yeah.
protect the brain. However, it's even better with the jaw relationship when everything is balanced. You don't torque like that when you hit the jaw. So when everything feels good, your brain feels good, you're gonna line up everything a lot better. And all these are neuromuscular feedback and how you can control your muscles better and how you're going to walk and how you posture yourself. By the sensory input, you feel everything feels good. And the line, everything's going to come back. It's like a switch.
That's so cool. I'm coming to San
Very
Francisco
cool.
so I can work out better. I'm gonna wear it when I'm working out.
Yeah.
Well, Dr. Chewy, thank you again, for
Mhm.
your time today.
Yes,
And
thank you.
we're definitely going to have to bring you back on the show because there's a lot more to talk about. But again, thank you so much.
Thank you.